Welcome to Project First Line, Infection Control Concepts and Actions for Healthcare Settings. Medical Waste. Our discussion will begin with an introduction to bloodborne infectious diseases. We'll then take a look at ordinary and regulated medical wastes, and how to safely collect, transport, and manage them. This also includes how to safely handle sharps. We'll then wrap up the presentation with key takeaways. Why does it matter that we talk about medical waste? Working in the healthcare setting, you are frequently exposed to risks of infection and injury. In fact, the CDC estimates that 5.6 million workers in healthcare are at risk of occupational exposures to biological hazards. And 10 to 25% of all healthcare waste is considered to be hazardous material that poses a variety of health and environmental risks. Considering the occupational hazards you face and the hazardous waste around us, it's important for us to safely handle, transport, and dispose of medical waste according to federal, state, and local regulations. Bloodborne infectious diseases. In the healthcare setting, blood and other body fluids are substances often found in patient care areas, contaminating a variety of surfaces and items. Staff can be exposed to blood through needle sticks and other sharps injuries, mucous membranes, and skin exposures. To protect ourselves, we wear personal protective equipment such as gloves, masks, gowns, and eye protection whenever there is a risk of exposure. We also clean our hands with soap and water or an alcohol-based sanitizer after handling waste, even if gloves were worn. Because we cannot determine if blood or body fluids are infectious just by looking at them, we must handle waste and contaminated items as if they are infectious, regardless of the perceived risk. There are two types of medical waste. They are ordinary medical waste and regulated medical waste. Let's look at each category. Healthcare waste is handled with care due to the risk that it presents. The goal is to identify the risk and safely manage the medical waste. Let's look at the first column, ordinary medical waste. Ordinary medical waste is defined as lightly to moderately contaminated wastes that are not capable of releasing liquid or caked-on blood or body fluids. This is to say that as long as the blood or body fluids are contained, then it's considered to be ordinary medical waste. Examples include lightly to moderately used personal protective equipment, items that contain saliva, sweat, tears, or any contained urine, vomitus, or feces. These items are to be disposed of in a trash bin. In the next column, we have regulated medical waste. Regulated medical waste includes items that are capable of releasing liquid or semi-liquid blood, caked on blood, body fluids, or other potentially infectious materials. To understand what falls under this category, we need to think of containment. If an item is soaked with blood and drips onto surfaces when picked up, it poses a risk to you and to others, meaning we need to safely handle and dispose of the item. If an item is so drenched with blood or body fluids that pools of liquid are left behind, then it goes into a biohazard bin since we do not want splashes or sprays to occur. Objects such as needles, lancets, scalpels, and broken glass should be disposed of in a sharps container to prevent injury and exposure. Category A waste, which we'll define and explain in a few slides, is also considered to be regulated medical waste. Let's put into practice our understanding of ordinary medical waste with a scenario. In this scenario, you have finished with cleaning and disinfecting surfaces in a patient care area. Your gloves are dirty and they are not saturated with any blood, body fluids, or tissues. In this scenario, your gloves should be disposed of in an ordinary bin. Remember, lightly or moderately used PPE should be disposed of in a regular trash bin. In this example, you are collecting soaked disposable pads that are visibly soiled with body fluids. You notice that the disposable pads drip fluids when picked up off of the bed. Remember, if an item is so soaked that it releases liquid that cannot be contained, dispose of the item in a biohazard bin. In this example, let's imagine you are collecting soiled bed sheets. Follow your facility's policies if you need to remove any waste or items from the linen. Then, place the item in a designated linen cart or bag. What is Category A infectious waste? As defined by the CDC, it's a specific designation for substances that are dangerous to human health as they can cause permanent disability or life-threatening or fatal disease in otherwise healthy humans who are exposed to it, which is why it's important to dispose of items into a biohazard bin if contaminated with a Category A substance. Listed on the slide are examples of Category A substances, which include viral hemorrhagic fevers such as Ebola and Marburg. Variola virus, which is the virus that causes smallpox, is also a Category A substance. A list of Category A substances can be found by following the CDC link found on this slide. Here is a list of the categories that fall under regulated medical waste. You might encounter items that contain blood and body fluids, such as saturated sponges, gowns, surgical gloves, and bedding. These items are just a few examples that are considered to be regulated medical waste anytime blood or body fluids cannot be contained, or if the item contains a Category A infectious substance. Regulated medical waste also includes potentially infectious waste, sharps, pathological waste such as body tissues, organs, and limbs, pharmaceutical waste, trauma waste, and radioactive waste. Waste should always be segregated and disposed of in a labeled or color-coded container. While you may not encounter certain categories of regulated medical waste in your line of work, it's important to be familiar with your facility's policies and procedures so that you are prepared to safely handle such wastes. To review what we've learned so far about ordinary medical waste and regulated medical waste, let's take some time for a few true or false questions. True or false? A used facial tissue with nasal secretions should be disposed of in an ordinary trash bin. The answer is true. Remember, ordinary medical waste, which includes nasal secretions, does not pose a significant or increased risk of infection, so it can be disposed of in a regular trash bin. Let's move on to the next question. True or false? Vomit should be disposed of in a biohazard bin. The answer is false. Vomit that has been collected into an emesis bag is considered to be contained and can be disposed of in an ordinary bin. True or false? Bandages soaked with blood should be disposed of in a biohazard bin. The answer is true. This type of waste poses a risk of infection and should always be disposed of in a biohazard bin. Let's now move on to discussing the process of collecting, transporting, and safely managing medical waste. Collecting medical waste. Here, we can see some of the best practices when collecting medical waste. Best practices include: wear the appropriate protective equipment, such as gloves, when collecting waste. It's important that you do not agitate, shake, or forcefully stuff waste into a bin, as this can create aerosols that can spread to patient care areas. Bags must be tied off or taped closed when full or done accepting medical waste. Remove your gloves and perform hand hygiene after handling waste. Transporting medical waste. While it may seem like a simple process, there are still a number of considerations and actions that must be taken in order to keep yourself and others safe. When transporting medical waste, Waste must be placed in a rigid, designated cart or container to avoid spillover or spread of germs. Containers should be closed to prevent spilling. Carts used during handling of medical waste need to be cleaned and disinfected with an EPA-registered disinfectant regularly, typically daily or whenever soiled. Remember, proper hand hygiene should be practiced after transporting medical waste, even if gloves were worn. Safe management of medical waste. Here are additional steps that can be taken to minimize the infection risks and to ensure safety. Always follow your facility's policies and procedures for managing medical waste. This includes processes for collecting, transporting, and disposing of waste. If a vendor is contracted to handle waste for your facility, there must be some form of supervision to ensure that waste is managed appropriately. Storage begins when the bag or container is full, tied off, closed, or sealed, and is no longer being used to collect waste. This is to say that bags and containers should never be reopened. Medical waste should be stored in an area that is inaccessible to unauthorized personnel. The area should also be properly ventilated. Medical waste should always be stored away from clean areas. And storage containers used to hold medical waste should be cleaned and disinfected regularly. As mentioned, sharps fall under the regulated medical waste category. Any worker who may come into contact with needles is at risk for a needle stick injury. There are several precautions that staff can take to protect themselves and prevent a sharps injury from occurring. The dangers of sharps injuries. The CDC estimates that each year 385,000 needle sticks and other sharps related injuries are sustained by hospital based personnel. This number is likely to be higher due to the underreporting of injuries and data being limited to the hospital setting. Approximately 25% of all sharps injuries affects non-users, such as clinical team members, EVS personnel, waste haulers, laundry workers, and others. Preventing sharps injuries. What precautions can we take to prevent sharps injuries? The first step is to recognize risks, which means seeing the potential for a problem to happen. To put this into practice, we want to be mindful of our surroundings. It's important to be aware of the possibility of needles and sharps being present in patient care areas, and exercising caution when handling trash or soiled linen. Another action that can be taken is the proper handling of sharps. This includes wearing PPE such as gloves, as they can help deter a direct puncture of the skin. It's important that we never use an ungloved hand to pick up a sharp object. When holding a sharp such as a syringe needle, it's important that we do not bend, recap, or break the needle. It should promptly be disposed of in a sharps container. Here are our key takeaways. Ordinary medical waste should be disposed of in a regular trash bin. Contaminated items capable of releasing blood during handling are disposed of in a biohazard bin. Handle sharps with care and dispose of it in a sharps container. Items contaminated with infectious waste are disposed of in a biohazard bin. You can keep exploring these topics on your own using the resources on this slide. Project FirstLine has a suite of products to help you learn more about how to recognize infection risks at work, where germs live in healthcare, and how germs spread. You can also follow Project FirstLine on social media. Thank you.